3 years ago, Walmart launched a new initiative to locate health clinics in its supercenters. The clinics are run in conjunction with local healthcare companies or hospitals and provide minor medical care such as flu shots, checkups, and treatment of minor injuries. A new venture was announced this week for St. Vincent's Health System in Little Rock to partner with Wal-Mart at its West Little Rock location. It's the first for St. Vincent's, but the fourth for Wal-Mart in Arkansas. Joining me to discuss the concept and some larger healthcare questions is Peter Banko, CEO of St. Vincent Health System. Good to have you back with us, Peter.
Thanks, Roby.
Let's talk about these in-store health clinics, or this in-store health clinic. Tell me how this came together with St. Vincent's and Walmart. Did you bid for it? Were you approached? Did you do the approaching?
We were approached about 2 years ago, so we've been working on this concept for 2 years. Really, I think aimed at making healthcare more accessible and more affordable. I think Walmart's onto something here, and we're proud to be partnered with them and their exclusive partner in Central Arkansas for this initiative.
Tell me what you think this is going to do for you guys from a marketing perspective and also from a bottom line perspective.
Well, a lot of people shop at Walmart, so right near the cash register to the supermarket area, they're going to see St. Vincent every day. We also think it's an opportunity for folks that don't have health insurance to get affordable care. All of our prices of our procedures are posted on the wall. We also take insurance. So if you do have insurance, the insurance companies we take out are all posted outside. The hours are posted outside. We're trying to provide for folks that do have a doctor, maybe after hours, if they've got an illness where they need a prescription and they don't want to stand in line for hours in the emergency department, that they can get quick and quality health care here. I think the important part about the partnership, too, is it's backed by a health system that's been here for 120 years. So it's not a company out of some city somewhere operating a clinic. We've got our doctors and our quality mechanisms to make sure we're delivering the best care possible here at Walmart.
And talk to me too, Peter, because the way this works, somebody comes in for some, a checkup or some minor symptoms of something. If they need to go somewhere where there is a more serious condition, then this is kind of the farm system to send them to a specialist or to a place where they can receive more acute care, correct?
Yeah, this is an access point. This is not meant for people to continuously use this clinic. If they don't have a physician, if their child doesn't have a pediatrician, the best place to get care is with a physician on an ongoing basis. So you need to take your kids to a pediatrician. If you're an adult, you need to see a family physician or an internist. So really, this is our strategy to get people that may not have access into our system in some way and get them hooked up with a physician for ongoing care. We don't want to see people here every week. We like to see them when they need to be here, when they've got a pressing illness and they can't get in somewhere, or if they don't have a doctor, we'll help them find one.
Tell me, do you foresee adding more of these clinics here within your footprint in partnership with Walmart, or is this kind of a test clinic? Let's see how it goes and then evaluate.
No, we're starting to go great guns. So this is a first clinic. By June of 2010, we'll also have clinics open in Bryant, Sherwood, and Maumelle. And if those four go well, as I said, we have the exclusive agreement for Central Arkansas. We see this expanding dramatically.
Well, all right. Well, congratulations on the partnership. Let's change our thoughts just a little bit here, and let's turn our attention to Washington, D.C. You and I sat down earlier this year and talked about some things that might be coming at the federal level in terms of health care reform. I'd like to get your thoughts on where we stand at this juncture. You predicted passage of a health care bill. I think that you may be accurate in your prediction there. Do you see some elements of a good thing in what has passed the House so far and is being debated in the Senate?
I think we were meeting with Senator Blanche Lincoln earlier this week, and she said it best is we need to not throw out good to find something perfect. So, is the House bill perfect? No, it needs some tweaks, but I think it's a good start. Amongst all the rhetoric on the television shows in the evening and the talk radio, I think we're losing sight that really we've got a grand opportunity as a country to provide coverage and care for all, and that's really what the aim of this is, and we're getting lost in some of the fights and battles of special interest groups. So I think the House bill is a good start. I think it's going to have trouble getting through the Senate, and that's unfortunate, but hopefully my fellow citizens can weigh in with their elected leaders and really push for something because it's better than nothing.
Well, don't group me into all those talk shows that you're talking about on TV and radio. Let's talk about, tell me what you think is really, really good in the bill right now. Where do you see some things that you honestly believe will make reforms to the current healthcare system in a positive way? Just one or two things.
I think coverage, trying to shoot for that 95 to 97% coverage for all is worthwhile. I think focusing in on prevention and having incentives for that is key to it. I think making sure that we've got incentives for physicians to go into primary care, family medicine, internal medicine, pediatrics. I was talking to somebody and they said a junior bank loan officer makes more than a primary care physician. I think we need to provide some incentives for those individuals interested in medicine going into primary care, because we're going to add some people into the system. We're going to need more primary care physicians. I think the public option, I think, has gotten beaten up and bashed a lot. I think having some other forms of health insurance, allowing insurance companies to sell across states, allowing without having another government bureaucracy, insurance plans in Arkansas allowed to offer some products to the folks that currently aren't covered. Just giving more options for health insurance is a positive part of all this. I think one that's probably a little bit controversial is I think physician-owned hospitals is not in the best interest of our community and the business community. I think we here in Central Arkansas need Baptist and UAMS and St. Vincent to be strong healthcare providers, and by cherry picking and skimming off things that are profitable and not doing the things that are unprofitable, like emergency care, is not in the best interest. We need in tough economic times, we need all three of our big health systems to be an economic engine for our community, and physician-owned hospitals take away from that.
I'm going to give you a chance to make a prediction now. You got a little bit more ammunition, a little bit more information. How do you see the rest of this healthcare reform debate playing out as we go forward the rest of this year?
I think with Republican victories in Virginia and New Jersey, a lot of the politicians are going to be a little bit gun-shy heading into this new year, 2010. I think that's unfortunate. I'm not, my football team, Notre Dame, isn't doing too well, and I've lost a couple bets lately, so I'm not a betting person, but I'd give it a 50-50 chance of passing somewhere in 2010. I think the Senate's going to be the tough place. The House has already done some tough work, but the Senate, given the way it works, is going to be tough to get out of there. So I'd give it a 50-50 right now.
All right. Well, you're getting a little bit ahead of us on our TV show. We're going to talk about gambling in our next segment. St. Vincent CEO Peter Banko, thanks as always for your time and your insight.
Yep, thanks for your great questions as always.
All right, when we come back, we turn our attention to gambling in Arkansas. Between Oaklawn, Southland, and the lottery, there's a lot to talk about. Plus, a teenager from Cabot takes her environmental passion and turns it into an entrepreneurial endeavor. I'm Roby Brock. This is Talk Business.